Thank you. Why am I here? Don't worry, this isn't some existential treatise. Imogen messaged me last September about wanting to chat about my experiences with lymphedema. Apparently people wanted to know more about lymphedema and from a patient's point of view. So would I be that patient? I was surprised. I'm not a lymphedema expert. What could I possibly tell anyone? But we talked a bit more. She's very persuasive. And here I am. There's obviously much more information out there now at the end of a quick Google than I could possibly share with you today. So this is very much my story, my experience of 17 years living with lymphedema. The early days. Many of you know my melanoma history, but since without melanoma I wouldn't have lymphedema, it does seem pertinent to give you a quick overview. I was originally diagnosed in October 2001, following a biopsy of a small lump with a primary melanoma on my lower right shin. I had a wide local excision of the primary and a further in-transit nodule they found, and a sentinel lymph node biopsy, which was positive. I then had a further wide local excision where they found a second in-transit and a lymph node completion lymphodectomy in the right groin, with no further positive lymph nodes. So there was some good news there. Oh, I've gone too soon, sorry. I can clearly remember my consultation following my first surgery, being told of the positive sentinel lymph node and the need for a lymphodectomy. So it looks like that might change in the future. And although it's nearly 17 years ago, I can still clearly see that plastic surgeon saying, you may experience some swelling after. That was my introduction to lymphedema, even though it wasn't named, and I hope today patients get told much better about possibilities of lymphedema. At that point, I knew nothing about lymphedema or the lymphatic system. It was my experience that lymphedema the provision of lymphedema services was somewhat patchy and variable, but I was lucky to be a patient at St Thomas's, so I was referred to the lymphedema clinic at their sister hospital at Guy's. Though I had to wait some time for an appointment due to demand, wound healing, and I fitted in a third surgery for an isolated lymphofusion and pelvic lymph node removal as well, just for good measure. And I do remember seeing a lovely, if somewhat overworked lymphedema nurse at Guy's. She gave me some leaflets, took some measurements for some ready-made compression hosiery that I could request on prescription from my GP. They weren't specifically for lymphedema, but that was all that was available on prescription at that time. She was especially delighted to find out I lived in Ealing, since Ealing Hospital had its own lymphedema clinic. So she referred me, assuring me that she knew the lymphedema nurse there and she was fantastic. And to be fair, this was probably the best thing that could have happened. Although I've moved out of Ealing Borough, I've remained a patient at the Ealing Lymphodema Clinic since early 2002. So I set about learning to live with lymphedema. Leslie Watts was my first proper lymphedema nurse at Ealing. She's moved on. I think she even left the business, but if anybody here has ever met her, then she's a lovely lady. And she ran a fantastic department out of one very small room and a storage cupboard in the Meadow House Hospice at Ealing Hospital. So it was quite daunting to actually go into the clinic when you're going into a hospice. But she laid the foundations for me learning to live with lymphedema. Information. Back then, that was before Google, there was a lot less access to information on the internet. The Lymphodema Support Network, the LSN, leaflets were very much my main source of information. They were and are a fantastic resource, and now all that information is available on their website as well. I'm sure I'm no different to other lymphedema patients, since I have very much a love-hate relationship with my compression hosiery. Back in 2002, the class 4 stockings I needed weren't available on prescription. The Lymphodema Clinic bought them out of donations. I had 2 stockings every 4 months. And I noticed recently the guidelines still state giving 2 garments is fine. 1 on, 1 in the wash. Obviously, whoever wrote that have never tried to dry the one in the wash overnight, especially if you do it by hand, which is what you're meant to do, though we never do. I learned very quickly that I had to wear my stockings every day. I tried once on holiday, and it just really wasn't worth the pain. Skincare is dull but important. I wash daily with aqueous cream. I dry thoroughly, moisturise with a good cream. I've tried several over the years, from the delights not of soft paraffin wax, you'd be ready to swim the channel after putting that on, to Diprobase, Cetraben, Zero Cream, Eucerin. It's important you get one that you're happy with because it keeps your skin in good condition and you've got to live with it. And the brand can be important because not all active ingredients are the same. I found as when I had one own brand type urea cream, and it was so solid that when I tried to squeeze it out of the tube, it came out the wrong end. I often found that if the GP was resistant to prescribing the brand, then getting the lymphedema nurse involved was quite good. Simple lymphatic drainage is a self-massage technique. I was taught it, but and it works better for some people than others, and I am a bit lax in its use. But I do have a long-handled, soft, bristled body brush that I use in the shower sometimes. Don't want to know too much detail about that. Exercise is important. I got shown lots of simple leg exercises to help with the swelling, but any low-impact exercise is generally good. Walking, swimming. Weight, it's a bit of a no-brainer. Our bodies function better at a healthy weight. I've been a lot heavier, I've been a lot lighter. Life gets in the way. Generally, the lighter I am, the better the leg is. I've had a few near misses with cellulitis, and having had to make emergency GP appointments on holiday to get antibiotics, learnt to always have an emergency supply. I got used to being an interesting case, which often involved GPs dragging in other members of staff to have a look. But I've always been more than happy to help educate. Chronic conditions are too often the poor relation, and typically GPs don't encounter lymphedema very often. So anything to spread the word. Talking of which, the LSN has funded the creation of a fully accredited BMJ online learning module, Chronic Edema and Lymphodema, and it's available free to all healthcare professionals, and it's well worth encouraging your GP or practice nurse to complete it. But I guess the biggest things were the smallest things, the changes you make to living with lymphedema easier. Not standing for long periods, so I shan't be here long. When sitting, putting your leg up, wearing shoes all the time. I used to be a barefooter, but no longer. Taking care not to get cuts, scratches, cracks, or insect bites. Our cats have the most rigorous flea treatment regime. I wear comfortable footwear, nothing that rubs, and you have to be ready for the fact that a pair of shoes that fit one day might not fix the next. And I've become the possessor of a fine collection of sensible, adjustable shoes. Though I know some of my fellow lymphedema sufferers aren't quite so well behaved in that department. It did take me a long time to get rid of my lovely pre-lymphedema footwear. I tried convincing myself that they'd fit again one day, but I had to give in on that one. Wearing comfortable clothing, generally loose-fitting, generally wear trousers. I guess that links more to the emotional effects of lymphedema, feeling exposed, thinking people are looking at your fat leg. I didn't wear skirts and trousers for a very long time and still tend to wear trousers. I used to feel very uneasy going swimming. I felt very exposed then having the scars and the swelling so on display. And it takes time to feel comfortable, and I've still not totally conquered that, but it's getting better. Anyway, for 3 years, whilst at stage 3, I had good control of my lymphedema, with around 10 to 15% swelling, and was getting on with living as normally as possible. And hopefully anyone here who has lymphedema will reach that position of relative stability. However, unfortunately for me, my situation changed dramatically in the summer of 2005. I had rapidly growing multiple lesions on my legs, hundreds, and metastases in lungs, liver. I had 6 months chemo, dacarbazine at St Thomas's with partial response, but the melanoma was growing again by mid-June. So I started the trial at the Royal Marsden, Sutton, which showed progression in spleen and liver after 3 cycles. My lymphedema went ballistic. affected both by the rapidly growing masses in the leg and the treatment and its side effects, a vicious cycle of increased swelling, making it harder to walk, which led to more swelling, and then with significant weight increase on top for good measure. So, that picture was taken on the 8th of September 2006. It's quite a handy place to be. And at that point, that was the peak of the swelling of the leg, and so the leg was at least over 60% larger than the left one. And my treatment for lymphedema during this time was limited pretty much to making sure the compression hosiery fitted. And I went from the round knit to made-to-measure flat knit at that point for increased compression and better fit. 3 weeks after that photo was taken, on the 29th of September, I started a new drug trial at the Royal Marsden, Chelsea, for an immunotherapy drug referred to then as MDX010, now known as IPI. I had 4 cycles, and my melanoma responded remarkably quickly, with all visible lesions reducing, as well as those in my lungs, liver and spleen, and the lymphedema stopped getting worse. It took a year, just over a year, from end of treatment, well, probably 2 years actually. And by the start of 2008, my melanoma was stable. So basically, I needed to take control of my lymphedema. My lymphedema nurse was happy to start the work on reducing the swelling in the leg at that point. So I embarked on the delights of multi-layer bandaging. For 2 weeks at a time, I'd go in 3 times a week, Monday, Wednesday and Friday for bandaging, which would stay on 24/7 until the next appointment. And that top photo is me. I'm hiding the leg. I've got a good photo stance going over the years. But that leg is bandaged with that quantity of bandaging at the bottom. So you do that for 2 weeks, and then you get re-measured, and then you'd wait for your new stockings to arrive and hope your leg didn't get more swollen in the meantime. The compression hosiery was now available on prescription. You just needed to train the GP and the pharmacy to ensure the stockings came back as quickly as possible, but it could still take several weeks. Bizarrely, when the stockings went on prescription, the hosiery glue, which I used to ensure that the stockings stayed in place, stopped being available, and we found it really hard to source it in the UK at a reasonable price. And it just so happened in 2013 we went to America and we discovered the delights of the medical supply store. And over the intervening years we've had some interesting visits, but by far the most bizarre was last September in Oregon. We couldn't find a handy medical supply store, but we did find LegSmart, a retailer of compression socks and stockings. Our staff are trained and certified for compression fittings and were experienced with over 25 years of knowledge. As you can see, they offer an extensive range of compression wear. But their expert fitter was the scariest, craziest woman you would ever want to meet. She seemed to think that she could sell me compression hosiery that I didn't want, just the glue, by slagging off the corrupt British socialist healthcare system and telling me I'd been putting my compression hosiery on wrong for 17 years. So we exited sharpish, with some glue, I hasten to add. So, taking back control and back to 2008. Weight. I also decided it was time I needed to do something about that. So that's me at my worst, and that's me at my best, and this is me now. So there's, so it's been variable. So I had several cycles of bandaging and was taught how to self-bandage at home to help maintain that volume reduction whilst I was waiting for the new hosiery to arrive. Between bandaging and the weight loss, I lost 5 stone in the first year. I managed to reduce the leg swelling from over 60% to around 30%, and it's been around that point ever since. And that's a very scary photo of my leg. So that was after I'd obviously just taken all the bandaging off. You can see all my visible lesions. That's why I'll never be NED, I think, because of those. So I went back to living with lymphedema, falling back on all those good practices I developed before stage 4. It's easier to get new stockings with more and more items available on prescription all the time. My lymphedema nurse regularly reviews my hosiery and we make changes, switching manufacturers, adding in new products. I don't bandage very often anymore because it is extremely time-consuming and not very convenient. But I do use wraps, like the ones in the top there, foot, calf and thigh ones, for when the leg feels like it could do with some extra help. I take prophylactic antibiotics and have done for about 4 years now, because just the years of wearing the heavy-duty compression hosiery has just taken its toll on the skin. But I remain fortunate never to have had a serious case of cellulitis. When Imogen asked me to do this presentation, that would have been the end. But I've got another chapter now. Because during 2017, I started having problems with my right hip. I was finally diagnosed with severe osteoarthritis. I needed a new hip. Scary decision, but my mobility was so impaired that it was affecting my lymphedema and my weight. The consultant I saw was brilliant. He knew all about the additional risks of having lymphedema. I organised a post-op appointment with my lymphedema clinic, though they couldn't fit me in for 3 weeks post-op. I made sure there was a lymphedema therapist at the hospital. Beside the increased risk of infection, my biggest concern was being able to get the compression hosiery on post-surgery every day, since I wasn't allowed to bend or twist, and I wouldn't physically be able to get my stocking on. Steve even practiced putting it on me. That was quite fun. Quite difficult, but we thought, well, I'll have to do, we'll do it, we'll manage. So on March the 8th, I had a total right hip replacement. It was textbook. I was back in recovery in under 2 hours, and it was then the fun started. I'd had a spinal block rather than a general anaesthetic, so I was totally alert, if oblivious, from the waist down. Whilst 3 nurses took nearly half an hour to put my compression hosiery back on. It did draw quite a crowd, and it would have been a YouTube sensation if anybody had had the guts to film it, but never mind. But it made me realise that Steve and I would never manage this ritual on a daily basis, so we needed some more help. So the lymphedema therapist at the hospital got involved, and she was brilliant. She recommended some donning and doffing aids from MediUK. You can buy them from other retailers. That's the lovely devices, bizarre contraptions at the top right. On first sight, the donning butler did seem a very weird thing, and we couldn't quite see how it would work, but you should have seen the look on our faces the first day I used it. It was a little miracle, and I still use it every day, and it's in my suitcase in the car. But I'm not sure I'm going to get it in my hand luggage when we go on holiday next month. I was very lucky, and I experienced only minimal increased swelling, and I think getting the compression hosiery on immediately was no doubt key to that, and I tried to be as active as I could. I also had my first ever session of manual lymphatic drainage, MLD, from a private therapist to help minimise the swelling before I could get back to my regular Ealing clinic. I really enjoyed it, it was lovely. I nearly fell asleep. It was very, very relaxing, and I definitely have some more, and it definitely helped. My regular lymphedema nurse measured me up for new stockings, and she was impressed with the donning aid. She tried to say, I've got this sleeve, this will work, and she failed at that, and she said, okay, give me yours, and she was well impressed, so it passed her test as well. And she got me some new Juzo wraps as well, which is the black leg there. And they're really soft and comfortable enough to sleep in, which is something I really struggled to do with my compression hosiery. So here I am, 3 months on, getting back to my normal. So to summarise, I'd say, don't be afraid to ask questions. Seek information from lymphedema specialists, trusted sources, other patients, Melanoma Mates Facebook group. Be happy with your treatment. If it's not working, then challenge it and find something that does. Take precautions. You do need to be sensible and don't take any unnecessary risks. You need to listen to your body and learn when you need to rest or when you think an infection might be starting. So make the adjustments necessary to live your life, but don't let it stop you doing anything.